So, Chris, what is sepsis, first of all? I think maybe, some people don't they might think, yeah, it's some sort of infection or something like that, but they might not know exactly how it happens or what it is.
Yeah, well, sepsis is more like a super infection. So it starts out as an infection somewhere in the body, and then kind of becomes systemic in the body and affects the entire body as opposed to being localized to like the lung or the kidney or your skin or something.
So what are some of the most common allegations of malpractice that involve, sepsis?
The most common is basically that the sepsis got missed or the caregivers involved in treating the infection in the first place. Um, just either didn't. For example, the most common places sepsis would come from is pneumonia. So the allegation would be, well, pneumonia wasn't treated appropriately, and then uh, progressed to sepsis because of that. Or in other situations, it's just not recognized. The person may have symptoms that could be attributable to a lot of different mechanisms, but the caregivers don't recognize that it's from sepsis and treat the sepsis.
So is the issue mostly that, the hospital, the nurses, the doctors, did not properly diagnose that this infection, that the sepsis was starting to happen, and they delayed treating it, and then that led to some serious complications or even death of the patient?
Right. In most cases, sepsis, is comes from a bacterial infection. So I mean, it could be easily treated with antibiotics if it's recognized and treated early on.
And so what are the complications then of getting sepsis? Can people die from it, or is it just, is it something that can be treated later on?
Yeah, unfortunately, yeah, people can and do die from sepsis. There's a whole, I mean, it can be anywhere from death to people lose limbs from sepsis. If the infection gets, into a limb or, cuts off blood flow. Uh, those are the, two of the most serious consequences of failure to diagnose sepsis.
And what are the key elements that a plaintiff needs to prove in a sepsis malpractice lawsuit, in terms of really proving that this was, malpractice, that this is something that the hospital, the doctors and nurses should have caught and didn't?
Two things. One, the symptoms that the patient was having, and then it's pretty much sepsis is a laboratory diagnosis. So if the person does have an infection and they're being treated, normally they're getting labs drawn, fairly frequently, and it'll show up in the person having a high white count, or it also affects a person's blood pressure. So looking at the tests and the test results is really important in being able to diagnose sepsis promptly and nipping it in the bud so it doesn't cause further injury.
Are there any cases where a hospital might see that a patient is starting to develop sepsis and then they just don't act quickly enough and they let it get out of hand before they have a chance to treat it?
Yeah, that's most commonly what happens in failure to diagnose sepsis cases is that the person's in the hospital, especially in a long term situation or in an ICU where they're maybe immune compromised, and they're just routine labs. When you're a patient in the hospital, especially in the ICU, labs are pretty much just drawn on a routine basis. The doctor put in an order for labs, every 6 hours or every 12 hours. And believe it or not, people don't always look at those lab results. And so they may not appreciate what's going on with the person.
So is there anything that a patient themselves or maybe the family of a patient can do to kind of advocate for, a timely and appropriate treatment of sepsis?
Yeah, it's a little bit difficult. I mean, most of the patients. I mean, this happens a lot to older people or immunocompromised people. So they're in a somewhat vulnerable position, and they may not really realize what's going on. So it's more, be more like a family advocate. So, I guess based on what I've said already, I just think asking, the nurses or the doctors what the lab results showed, or asking about infection, asking about the white count, those kinds of things.
And then finally, if you do, go forward with a sepsis malpractice lawsuit, what could be the potential outcome of that type of lawsuit?
In a sepsis lawsuit, you can recover compensation for, if it does result in death, that would be what's called a wrongful death lawsuit, and the family can recover for the loss of their loved one. If the person does result in a loss of a limb, the person can recover for what it would take to make up for that. Either future treatment or physical therapy, other aids that'll make their life easier to make up for having lost a limb. You recover for lost wages, for time lost from work. All those kinds of things are recoverable in a sepsis malpractice case.